My name is Dr. Azar. I am the managing partner here at Genesis Medical Center. Genesis Medical Center is a comprehensive clinic where we provide wellness and preventative medicine to our clients. Mainly, we are in the business of providing stem cell therapies, PRP therapy, IV vitamin therapy, hormone replacement therapy. We treat conditions such as joint disease, autoimmune diseases, neurocognitive diseases. We are one of the only clinics that specialize in these things specifically. We don't do it as a side. The main difference that we offer to our clients is that we plan and make it our intention to educate our clients before they make decisions on treatment. We have time to spend with our patients, and I think that increases the quality of care as well as the quality of compliance. Greetings to everybody. My name is Dr. Azar. We're here on Shura TV. This is the show brought to you by Genesis Medical Center. Today we are sitting here and it's Thursday, and we wanted to get back on air to see how you guys were doing and how everything's going. We're currently again in the midst of a quarantine that was ordered by our government. The federal government, the U.S. government, they've ordered everyone to stay home and not gather more than 10 people at any type of gathering, except essential services are remaining open, which are, the food services and the medical services and some other type of services that are essential for everyday living. I hope that you guys are doing well and you're not panicking and you're at your homes and enjoying some time with your loved ones, with your children, hopefully with your spouse or with your friends or possibly your aunt, uncle, grandma, whoever you're with. And again, it's a time for us all to reflect and to make sure that we stay home, because it is a public duty on all of us to try to minimize the transmission of this coronavirus. As you all know, the coronavirus is now increasing in terms of its strength here in the U.S., and we've had approximately about 157 to 160 deaths so far, and there's over 11,000 infections now in the U.S. And now that we have a little bit more testing taking place, we are going to see more infections, and that shouldn't startle you or alarm you, but that's just the curve that we're trying to flatten, where we'll see more infections, and as there's more testing, we'll see more incidents of the coronavirus in people. As you know, just to review very quickly, if you do have symptoms or if you've traveled to those areas that were endemic, like Iran or China or Italy, anywhere from Europe, it's important that you know what to do if you have those symptoms of coughing, sneezing, sore throat, fever. If you have any, sometimes aching joints with it as well. And now they're reporting that, a good 35% plus are reporting diarrhea with it. So these are the symptoms to look for. And if you do have them, call into your urgent care or go to your urgent care and try to get assessed, and then see what they advise you, whether you need testing or whether they tell you to just keep isolated at home until you see the virus through. It's important, again, things to remember: keep hydrated, eat well, sleep well, don't stress. I know it's a very anxious time, but it's important for you not to stress and try to, this situation, there have been many obstacles that have come in the course of human history, and the human being, with the help of our patience and perseverance, we are persistent, and we are people that can get through things. So, there have been epidemics before, pandemics, and the human species has made it through with the help of God, with the help of society, with a lot of acts of good nature that we're seeing happening. A lot of seniors now, the grocery stores are having specific senior hours. So they don't want, because they know that they're more vulnerable, they have specific hours and they decrease the number of people at the grocery store, and they're open specifically for seniors to shop. And if you're a young one and you have grandparents or your parents are older, please call them, talk to them, and make sure that you tend to their needs and take care of them and get them groceries if needed. So these things are very important to keep in mind. As humans, we can't lose our human touch. And I know that it's very disheartening at times, but I think if we focus on our human morals and our ethical behaviors, I think we will see this through, and we can help each other and help society in general. At our clinic in Irvine, we've had a lot of people come and they're being feeling weak or these things, any kind of symptoms they had, our doctors see them, and then we give them the advice that's needed for them. But typically they're coming in and they're doing a lot of healthy people are coming in as well, and they're getting different IV vitamins and nutrients, and they're getting they're buying supplements that they need. So they're doing all these things, and it's good. But mainly, it's important to again, get enough sleep, don't stress, eat a balanced meal while you're at home, and make sure that you're doing activities at home that aren't stressing you too much. You can watch the news, but if you're watching news too much, it's a little sensational sometimes, and it could get daunting, and it could increase the anxiety as well. So there's lots of online tools now that are for mindfulness and for meditation, as well as they have exercise routines. You can take advantage of all those things, and a lot of the subscription things that you had to subscribe before, now they're offering it with with free subscriptions at this time because of the number of people that are at home and are using these things. So it's very important. And then the other thing, a lot of your doctors now are actually offering telemedicine, and the government just relaxed the HIPAA rules so that if you want to see your doctor, you can actually FaceTime the office and see the doctor and do a consult that way. So that's very important. So if your doctor, if you need to go to your doctor's office, you can call them ahead of time and ask them if they're doing consultations through FaceTime or Skype or any other technology platform that they have. This would help us keep isolated and keep the social distancing and not risking anybody else getting any type of pathogen or virus. So this is another thing that you can do. A lot of people are ordering, food. A lot of restaurants are, kind of tanking in terms of business, but they need your support. You can still order food and they're delivering. So you can check on that and see if your favorite restaurant does that. That would be great. I'm sure they would love it if you order from them for delivery, and that kind of keeps their morale up as well. The other thing with doctors, it's very important now. They're noticing that 10% of the infected are the medical professionals and the healthcare workers. So it's very important for them to have the protective equipment. It's very important to do, and unfortunately, we are at a shortage. A lot of these private industries, as you see, are purchasing this protective equipment and masks and goggles and gloves and gowns, and they're donating it to their local hospitals, or they're sending it to their local urgent cares, because it's manufacturer-wise, there's a big shortage, and hopefully that can change soon. A lot of people are in the pipeline, and they've ordered and they're just waiting. A lot of our colleagues that we talk to, in terms of they have their own private clinics, they're like, we've ordered masks, we've ordered gloves and things like that, but it's all kind of bottlenecked and we're not getting it. So there's a lot of philanthropists and independent churches and things like this that are well off, that have bought these things, and they're kind of giving it to the medical community so they can utilize until their orders come through and they can order for themselves. So that's the situation that's happening right now. I don't have to explain the economy for you guys. There was a promise from the federal government to give each person not making 100,000 or below, anyone who makes 100,000 or below, they were going to get $1,000 to $2,000 per adult per household. So those things are in the works, and we'll see how they can help people, because people are at home and people are kind of feeling it in their pockets. So it's important to keep that in mind. And if you need more information on those things, you can go online and search it, or you can reach out to us and we can email you and give you information on that as well. So those are the things to look for in terms of the coronavirus and the situation we're at. But most importantly is to isolate yourselves and stay home with your families. And hopefully we'll see this through. I think we have another 7 to 10 days that are actually crucial, and we'll see which way this thing curves, and hopefully we can see it through. And within the next 2 weeks, we'll know how long this will last. There are some estimates that it's going to go on till June, July, and then there was one estimate in the Washington Post that I think said there might be an 18-month extended some form of quarantine. So there's varying degrees to it, but in reality, people just don't know. It depends on how many infections they get and how overwhelmed the hospital system gets. So please, abide with the rules and regulations that are set forth by your county and by your state and by the federal government. And it is spring break now. There's a lot of people they're showing on the beaches. That is not a smart thing to do. That's actually, I consider it negligent for society to be doing that, because this is something where you're in the mainland U.S. and there's a potential to pass this virus on and really make things tough on your medical professionals at the hospitals. So, heed the warning. It's very important for you to make sure that, you stay home. On the bright side of things, there's been a couple of drugs that have been in the process of getting fast approval. One drug is chloroquine, which is an anti-malarial, and they've seen it in China and in Italy. They've been using it, and specifically for people who have respiratory disease with coronavirus, because the coronavirus attacks your lungs. So these people that they've seen severe respiratory disease, they've given chloroquine right away, and they've seemed to have recovered. So this is good news. And this morning at their news conference, they mentioned that the FDA is going to kind of look at this at a very quick, in a quick way, and try to approve it for use with coronavirus. So that's something where there's a drug that's been used for over 40 years in the U.S. So the side effects and the usage is already known. So it's something that, and also another drug, the remdesivir. It's another antiviral, and they're looking at that the same way. They want to pass it through the FDA and make it utilized specifically for coronavirus. So that's up and coming, and today they mentioned it, and that gives us a glimmer of hope that there are things that we can do to reduce the severity of this virus. But the best thing is to have social isolation and not get it in the first place. But if you do get it, it's not the end of the world. You hear about a lot of these basketball players, actors, actresses, they've got it now. And, they're living with it. And, 80% to 85% of the people do well and get through it. And you'll be fine. Just the key is to isolate yourself and not pass it on to other people. This is a societal effort, and everyone has to participate and take it very seriously. So those are the things that are there. Today we wanted to discuss a little bit about some of the respiratory issues that you might have that might get exacerbated with co-infection with the COVID-19, with coronavirus. Respiratory disease is anything that affects your lungs, obviously, and there's multiple types of diseases. They divide it into obstructive versus restrictive. Obstructive being, your normal asthmas that people have, your emphysema, a lot of these types of chronic bronchitis. All these things are the obstructive diseases. And then also there's the restrictive. The restrictive is more of the interstitial disease between the lungs and the alveoli and the branches of the lungs. So there are two different types of patterns, but some people have all these diseases that are already there, or people who have worked with people that had in the past tuberculosis and all these type of infections in the past, or they've had lead and they've worked with coal or in gas stations, and they have issues in the lung that are a result of their occupation. So it's important that we realize that these types of people that have these issues, you need to be careful. You need to make sure that you isolate yourself and don't expose yourself to people that are symptomatic, or people that are coughing and sneezing, and specifically for people who have asthma and they get attacks. Breathing is very important. Oxygen is important. And what COVID-19 does is it decreases that function tremendously. So it's important that if you do have respiratory issues, that you isolate yourself and you make sure that you're getting enough oxygen and water and good nutrients. And if you're on any medications, make sure you're taking the medications regularly. If you have emphysema medications, you're on those regularly. It's very important. Or if you have any type of interstitial disease, or if you have pneumonia, you take your medications as prescribed. Don't skip out on them. You make sure that you take them, and it's important to take them regularly and keep on top of that. I think the majority of the people that have any type of respiratory issue are being followed by a pulmonologist typically. But if you're not, you could always consult now through telemedicine, hopefully, with your doctor and tell them and say, hey, I have wheezing or I have this. Do I need to be on some type of medication so that it doesn't get worse, especially in this environment? That's what I would advise in general. But your specific doctor would give you the proper medications and proper advice that you would need. Typically, again, a lot of people were asking in terms of respiratory illness. Usually it's a flu-like symptoms that you get, right? So if you, a lot of people get, runny nose, sore throat. They get aches, joint aches, coughing. Also, the fever's usually high. You get a 102, 103 fever. You got to see it through. And these things, in the rare cases, there are people that get some type of nausea and vomiting with it too, if it's severe. There are some people that are sensitive and they get that. So these are the things to look for and make sure that, if you do have any of these things, that you get treatment and help right away. Best thing would be, again, to call your urgent care or your doctor's office and first see if they offer telemedicine services. So you can just, with your phone, you can be on on FaceTime with them, or you can be on Skype, or they have Zoom, and or they might have their own telemedicine platform as well. So either of those things, because we don't want to go into the office unnecessarily unless it's very essential. That's very important. So those are some things to keep in mind. We're going to keep it kind of short today. But if you do have any questions or concerns, you can always reach us at genesismedcenter.com. We'd be happy to answer your questions and help you navigate through. And also, if you needed any type of assistance in terms of guidance on health issues, don't hesitate to call us or to text us or email us. We're here to help you, and we hope that you stay strong and we'll get through this. It's a very, critical stage and critical time we're living in. But, the future does look bright, and you should always keep yourself in terms of optimistic about it. That's about it for today. I wanted to thank you for watching, and hopefully you can check out our website and our Facebook page for more. Thank you.